Hi, this is my video for pharmacology on antiemetics, and these are the agents that reduce nausea and vomiting, and a couple of factors can induce that. It's motion sickness, chemotherapy, surgery, and pregnancy. So we have four classes. The first class is phenothiazines. The mechanism of action is that they have antiemetics, like I had said. Their exact mechanism is not understood completely, but it's believed that they inhibit the dopamine receptors in the brain. And some of them, like phenothiazines, one of them is promethazine. And like I said, they are used to treat nausea and vomiting, and a lot of times they use them right before chemotherapy. So nursing assessment is you would want to assess their medical history, their allergies, and any contraindications to these medications, and then check their current medications to check for interactions, and then determine what their therapy, their regimen should be. The effectiveness, how you would determine the effectiveness of the drug is you would monitor the relief of any nausea and vomiting, especially after chemotherapy, and observe for any adverse reactions, which is dizziness, drowsiness, and extrapyramidal symptoms. And this would just basically cause discomfort in their life. And then potential adverse reactions are sedation, dry mouth, blurry vision, and constipation. So one thing that's important on this medication, this classification, is that you would want to warn them of the risk of photosensitivity. So my mnemonics for this is PAPA. P, it helps prevent nausea and vomiting. A, it's antagonizing dopamine. P, for potential side effects. And A, for allergies. Watch for any allergies. Okay, the second class is the 5-HT3 receptor blockers. So an example of this is ondansetron, and it works by blocking serotonin receptors, and it works in the GI tract. Okay, so by inhibiting the serotonins, it reduces the nausea and vomiting signal into the brain, and it migrates down into the mitigates down into the GI area and reduces the symptoms. So again, used for nausea and vomiting, but for chemotherapy, radiation therapy, and post-op. Again, for nursing assessment, you would want to do their medical history, their allergies, and any contraindications for this, and their medication list for potential interactions. Nursing assessment, you'd want to monitor their relief of the nausea and vomiting, assessing any changes in vital signs and dehydration, and just their overall comfort, reassessing their pain or their nausea and vomiting after they take the medication. Potential adverse effects is watching for headaches, constipation, and diarrhea. And then the allergic reaction would be rash, itching, swelling, and even breathing difficulties. So you would want to report any of these to the doctor if you had any of them. The mnemonics, on this one is SUN. S for serotonin blockade. O is for optimizing comfort. And N is for the nursing assessment that you would want to do. Class 3 is your non-phenothiazines. And these are your dopamine receptor antagonists. So these are used for medical purposes, including the GI conditions and preventing nausea and vomiting again. This one, as I said in the name, it works primarily on the dopamine receptor antagonist. So it blocks the dopamine receptors in the brain, and it reduces the nausea and vomiting reflex. Okay. Additionally, it can promote GI motility by enhancing the coordinated contractions of the upper GI tract. All right, so the rationale for using it is for diabetic gastroparesis, and it's where your stomach takes too long to digest. It can also prevent and treat nausea and vomiting associated with surgery and chemotherapy. In some cases, this can actually facilitate small bowel intubation and be an adjunct to certain radiological procedures. assessment, you would want to assess medical history, allergies, contraindications, and the patient's current medication list. All right, and you would also want to know about any symptoms or underlying conditions, like if they had GERD, since it can affect the GI. Nursing assessments to determine the effectiveness of the drug is you would want to monitor before and after taking the medication for nausea and vomiting, and also if it includes improved the GI motility. So potential adverse reactions, it can cause drowsiness, restlessness, involuntary movements, and Parkinsonism. So you would want an allergic reaction would be a rash, itching, swelling, and even difficulty breathing. And you want to educate the patient on the potential risk of drowsiness or dizziness, and to not do any driving while taking this medication. Mnemonics for this one is Mr. D, and M is motility enhancement, R is for receptor blockade, and D is for drowsiness, which is one of the common side effects. The last class we have is the substance P, neurokinin 1, NK1 receptor antagonist. These are used to treat chemotherapy-induced nausea and vomiting, and it's the delayed phase of the CINV, which is this prototypical drug is an aprepitant. So the mechanism of action is it's a neuropeptide, and so it plays the role in transmitting signals related to nausea and vomiting to the brain and also to the GI system. NK1 receptors are involved in this pathway. Let's see, so again, it works on blocking the substance P at the NK1 receptors. The rationale for using it is to prevent delayed nausea and vomiting associated with chemotherapy, and they're usually used in conjunction with other antiemetic drugs. Okay, so nursing assessment is assessing the patient's medical history, allergies, and contraindications. You check for the drug interactions with the other medications they're taking. Nursing assessment is that you would want to monitor the patient for the prevention of delayed phase CINV. So this phase usually occurs after 24 hours of doing chemotherapy. You also want to assess before and after for any changes in vital signs and the patient's overall comfort level based on their nausea and vomiting before and after taking the medication. Adverse effects, this may cause fatigue, dizziness, and hiccups. And allergic reaction would be rash, itches, swelling, difficulty breathing. So you would want to educate the patient on these adverse reactions and to call the doctor immediately. The mnemonic for this one is SPA. So S is for substance P blockade, since they block the substance P to prevent nausea and vomiting. P is for patient comfort, because we want them to be comfortable. And A is for assessment, constantly assessing your patient. My reference is through the Nursing Pharmacology book by Tucker 2022. That's all.